One of the most common things that we treat are knee injuries, and we see a wide-ranging, pathology, whether it is, a young high school kid who has hurt their knee playing sports, or the weekend warrior that's had knee pain playing tennis this weekend. Typically, when people come in to see us, sometimes they've had, prior evaluation, whether it's by their primary care doctor or the emergency department, or they just had an injury this weekend and we've gotten them in that day. The typical process is we get them in the office, we make sure we get x-rays, and then we do a really big physical exam on them. I think one of the most important things is to really be able to listen to the patient and see what's going on with the patient and examine them to see, what is exactly wrong. And sometimes just based on a physical examination and x-rays, we are able to avoid such things as an MRI, as we are able to treat and diagnose them without an MRI. But if necessary, we do get further advanced imaging to figure out what may be the root cause of their problems. We do a wide variety of surgeries, whether it's minimally invasive, knee arthroscopy surgeries, such as meniscus surgeries, but we also do a lot of revision surgeries, revision knee ligament reconstructions, as well as more invasive procedures such as cartilage transplants, or even realigning some bones around the knee for various problems, including arthritis. We do treat arthritis in the young person, whether it is surgically or non-surgery. Many of these times we can get people back to the activities they enjoy with physical therapy or even injections, but not everything needs surgery. One of the most important things we see is lack of knee range of motion. People come in with stiffness, they end up having pain that's exacerbated by this stiffness. We do a lot of surgical treatment options, but we also do a lot of non-surgical treatment options, whether that is referring you to physical therapy, and dealing with our specialized cohort of physical therapists that we use for some of these issues, or even performing in-office injections. We perform a wide variety of injections, whether it is steroid injections, whether it's lubricating type injections, or even some of the newer orthobiological treatment options such as platelet-rich plasma or PRP. All of these, as I described to my patients, are tools in the toolbox. For knees, for follow-ups, we typically are seeing people about a week and a half, 2 weeks after surgery, and usually at that visit we're getting sutures out, we're checking range of motion, we're seeing how the wound is healing. At that visit, depending on the nature of the surgery, a lot of times we're making that decision if people need to go to physical therapy after surgery, or whether they can do this on their own at home. Usually the second follow-up visit is about 4 weeks later, or typically 6 weeks after surgery, when at that point we're hoping people are getting largely back to what they were doing before surgery. And depending on the procedure, we sometimes follow people even for 3 months, 6 months, even up to a year, and pretty much until people get back to the activities that they want to do or need to do.